My name is Hunter Dimple with the Glendale WMSA. I see in your chart that you're here today for a follow-up after having surgery.
Yes, sir. Yes, sir. I'm here for following up for my hip, my left hip replacement surgery, and then also in the meantime, ended up getting into a motorcycle accident last Wednesday, and so I came to see that, and so the nurses pretty much told me just to follow up with my appointment that I already got with the doctors, and they'll they'll go ahead and look at the X-rays and everything when it comes to my lower spine. But yes, sir. The follow up is just mainly for my hip.
All right, and so regarding your hip, have you noticed like any like pus or infection coming out of the affected area?
No, I would say mainly just the swelling. The swelling really hasn't. I mean, the swelling went down obviously from when I first got the surgery, but it's still soft, still a little swollen a little bit. It doesn't hurt as much, but it definitely is irritating at certain times, especially early in the morning. Getting out the bed, kind of doing a lot in the morning, walking the dogs, food, dishes, stuff like that. It gets real irritating. It almost like flares up, and I have to take a good 30 minutes to 45 minutes break.
All right, and on a scale from 1 to 10, how would you rate your pain today, like all together, that being the spine, the hip, all of it?
I'll say a 6.5, 7.
All right, well, I'm gonna go get the doctor. Can I grab you a glass of water?
Yes, sir. Thank you.
Okay, I'll be right back with the water, and I'm gonna go get the doctor. Hey, Illy, patient came in today with a follow-up. I seen in his chart he had hip surgery. He claimed that he got in a wreck last Wednesday and hurt his lower spine.
Okay, I'll be right in with him.
Okay.
All right, Mr. Subaki, my name is Dr. Illy Fields. I'm here to follow up with you today. My assistant tells me that you were actually in a wreck after surgery. I thought I was just following up with your hip. So, can you please tell me a little bit about what happened? Please describe your symptoms, how long they've been occurring.
No, yeah, I was driving my motorcycle, and I pulled out of one state burger, going ahead and making a right there near the new trading facility. And the vehicle came from behind me, hit the back end of my motorcycle, and I kind of flew probably maybe like 15, 20 feet. There was pedestrians, everybody next to it to make sure I was all right, and I was pretty all right. Nothing. I had some scrapes, some bruises. What made me come into the hospital was the fact that when I ended up having to call somebody to come pick me up, and in the process of sitting in their car and moving around, and then later on that evening, I kept noticing my lower back kept feeling pinching towards the lower back, and when I would move, my right shoulder and my right arm would get numb, and my right leg. And hip replacement wise, I would say I probably did some damage to it. I don't know what damage I've done did to it, but I probably did some damage to it. It just hurts even more.
Okay. So that's a lot going on. I'm sorry to hear that. As far as your back, is the pain radiating when you're talking about your leg or your shoulder, or is that separate injuries?
I would say radiating. Definitely like if I've been down too much, I can start to feel it pinch maybe towards uh, I gotta count. I would say lower to mid back. I can't remember which spinal bone that is. I can't remember what it is, but right there between the middle of the back going towards the very lower part.
Okay, and when we describe your pinching on a scale from 1 to 10, how bad would you rate that pain?
But when I bend over, when it pinches, whatever, I say that's probably like an 8.5, 9.
Okay. And as far as your hip goes, is your pain more internal or surface level, like where your incisions are?
I would say internal. It's definitely internal. It's almost like that. Excuse me. It's almost like that dual pain throbbing that does not go away, and it gets worse the more you either massage it or move your leg or something.
Okay. So we're going to get all of that checked out. And I will definitely get you some pain medication going. First, I need to ask, do you have any allergies I need to be aware of?
Nope.
Okay, perfect. I'm going to have Hunter here get a vital assessment on you. I'll probably take a physical exam, maybe some imaging when we're done. But first, I'll get this vital assessment, see how that is looking, and if you can get some pain medication right after.
Gotcha.
All right, I'm gonna go ahead and get your vitals. Okay, I'm gonna go ahead and check the pulse. All right, so it looks like his temperature is 98.3. His blood pressure is 127/80, and his heart rate is 87 beats per minute.
All right. So what we're going to do now, vitals are looking stable. I think it's okay to give him some IV pain medication. And I definitely want to get some labs on you just to make sure there's no infection and that your wound and incision was healing okay. So I'll start off with that.
Okay, while you're giving the medicine, do you want me to go ahead and get the blood sample?
Yes, please. I'm about to insert this IV now. On a count of 3, just take a deep breath. It might give a little pinch. I'll try and be quick. 1, 2, 3. All right, Hunter, you can go ahead and get the blood sample. I'm going to administer some IV pain medication for him.
All right, I'm gonna go ahead and draw your blood now. It'll just feel like a small pinch.
All right. So I'm going to let this pain medication settle for a second. I'm going to go run your blood work and we can go from there, okay, love?
Yo, take a seat. Take a seat.
Is there anything I can do for you or grab for you? He's running those labs.
Hey, hold on, Jim. I ain't gonna lie. Sometimes my hands be too occupied where I can't do stuff where I want to go.
No. Take a seat. Let's hold Mike. Take a seat. We'll wait. We're on official business. It's okay.
You said
We're
what?
not here to cause problems.
All right, what I'm seeing here is an elevated white blood cell count. So it's definitely showing a little bit of sign of infection. I do want to take x-rays of your hip and I want to take x-rays of your back, see what's going on there. But as far as the infection goes, I will need to send you home with antibiotics. Did you complete all your antibiotics from surgery?
Yes, I did.
Okay. So maybe this is just something that happened if like the wound busted open, any stitches popped, anything like that. Maybe there's infection from that. We'll definitely give it a check. Hunter, will you go ahead and turn on the radiology equipment for me? While he's doing that, I'm going to quickly take a physical exam of your back and your hip. I hope the pain medication is working for you. Let me know if you're tender to touch at all, and I'll get started now.
Thank you.
Okay, so I am seeing some swelling and redness. Not a lot, but you do have minimal drainage, which is definitely indicated with the infection from the white blood cell count. I'm now going to take a quick physical exam of your back. Let me know if anything hurts and I'll stop.
All right.
Hey, where's she at?
foot or two. I'm just wondering if these guys that are RPing to the standard that I appreciate, if they close their eyes when they do it or not. You know what I mean? Like, it sounds like they do it IRL.
Mr. Subaki, have you been out of the country at all in the last 6 months and or around anyone that has tuberculosis, TB?
Hopefully not, but yeah, I've been out of the country in the past 6 months.
Okay, where was that?
You said where?
Yes, sir. Where was that?
I was in Valencia, Spain.
Spain. Noted. All right, that's in the chart.
All right,
What
Mrs.
happened?
Sabaki, I don't see any deformity noted to your back. That doesn't mean there's nothing going on there. I'm first going to begin this x-ray on your hip, so just give me a second. I'm going to need to hold your leg still. You try and hold your leg still as well. If anything hurts, just take a deep breath and bear with me.
Let me try to adjust the X-ray machine real quick.
Yes, please. He's also moving his leg a little bit. I'm going to need him to take a couple deep breaths, Mr. Subaki, so we can keep this leg still and we don't mess with any motion artifacts.
Gotcha.
There it is. Okay, let me take a look here. So I am seeing some tissue swelling. I'm not seeing anything wrong with the bones or the surgery itself, but you absolutely do have soft tissue swelling. I'm going to also move this x-ray now to your back and we'll see what's going on there. All right, I'm looking. Okay, so I do see an L5 to S1 herniated disc, foraminal stenosis. So we definitely do have an injury here to your lower back, almost towards your sacral bone. What I'm going to do here is I'm going to give you a back brace and I'm going to set up an appointment. How do you feel about injections?
Like pain medicine injection?
Yeah, so it's an epidural steroid injection. I just want to make sure that we exhaust all measures before we take the leap with surgery. They should, I guess, help you for a good 6 to 8 weeks, lessen the pain. Well, the hope is to lessen the pain. And if it doesn't, then we can move forward with something else. But I would like to start leave for right now.
Yeah, let's do it then.
All right, so I'll set you up with an appointment in 1 week and we will do that steroid injection. As for the left hip, I'm going to send you home with antibiotics. I'm going to have Hunter Dimple here put the back brace on you.
Good job, doctor.
Thank you.
Okay, I've got that back brace put on him.
All right, so for precautions for your back, I would like you to take it easy. So as far as the back brace goes, I want it to be worn every day until the day of your injections. We'll set you up for next Thursday night. And as for your hip, I would like you to take this 10-day supply of antibiotics. I do not want you to miss a day whatsoever. We're going to take one in the morning, one at night, and then I'll see you for your hip in 10 days when that antibiotics is finished. If you by chance have any more pain, please come in and see me. I'll also send you home with some painkillers. Do you have any questions for me before I let you go?
So we won't do surgery until 10 days from now? Or are we going to do it before 10 days?
So your injections isn't quite surgery, but we'll do injections next Thursday. And then we will do a follow-up on your hip when your antibiotics are finished in 10 days. So we'll have 2 separate appointments for right now. Now, in that week, I will probably set you up for another week after the injections to see how your back is feeling. And if it is still in pain and you would like to move forward with surgery, we can do that as well.
Gotcha.
All right, all right. If you can you slide me your ID so I can log your appointments for you? Hunter, I will have you take his insurance and get that covered, and we can get him his discharge paperwork. Okay, perfect. So do you have any questions about the injections or the appointment in general?
No, not really. I trust you.
All right, just make sure you take your antibiotics twice a day for 10 days. I'm going to give you a supply of oxycodone for your back every 6 hours as needed. And then I will see you in 1 week for your back injections.
Shit, I ain't heard that word oxycodone because I got my wisdom teeth sticking out.
Yeah, given your pain, score, and car crash, surgery, I just want to make sure you're all good.
Yes, ma'am. Thank you.
You are so welcome.
Here's your insurance card back, and then here's your discharge papers.